Hi everyone, this is Aurelie Najm from Glasgow reporting from EULAR. I'm still at the conference center. I had an amazing day with several really interesting sessions. One of them this morning, there was a presentation about the IRAEs treatments and survivals when it comes to patients treated with targeted therapies after a cancer that would have been put in remission, treated with, immune checkpoint inhibitors, but then they obviously present all these adverse events that need to be treated with immunosuppressive drug. And there is obviously a question that is, by treating these people by immunosuppressive drug, do we increase the risk of uh, relapse of the cancer and subsequently do increase the risk of death? So this question has always been kind of hanging around, and it's always been a bit questionable. And, we don't have many studies that were looking at that. In fact, there was only very few studies and very small numbers of patients showing that, some of the treatment, immunosuppressive drugs, targeted therapies could have bad pejorative impact on death. And so this oral presentation, so it's OP0270, is a French database registry study. They looked at all patients treated with checkpoint inhibitors and developed an IRAE, and they looked at all different IRAEs, not only rheumatology specific, and they matched them with patients that were receiving targeted therapy versus none. And so the amount of patients was massive. There was over 70,000 patients receiving checkpoint inhibitors. Amongst them, 11%, above 7,800, developed an IRAE. And amongst these people, 330 did receive a targeted therapy, whether it's biologic or targeted synthetic DMARDs, as opposed to 990 that did not. And they were only look at IRAEs that did lead to an hospitalization, so not those that were treated as outpatients. And so they matched these two different groups in a way that they tried to minimize all the bias, but obviously it's still a retrospective registry study, so there are some bias, but they matched them in many different ways, they adjust for over 30 variables, including the dosage of corticosteroid they were receiving, and including, and that's an important one, the delay between the time they went to remission until the time they had the IRA. And so it was fairly interesting to see that. So first of all, the main complication that led to hospitalization as an IRA was colitis, but amongst their population there was 10% of patients that did develop rheumatological IRA that led to an hospitalization. But overall, the data is very reassuring, and this is what I wanted to share with you. So if you look at death and survival, in fact, survival is similar. There was no difference. Whether you look at all patients, whether you look at colitis patients that develop colitis, so the majority of the population, or whether you look at those specifically who did develop rheumatology complications, there was no difference in survival. So I think, so this is only the data for biologic and target synthetic DMARDs. There are data on the way for conventional synthetic DMARDs as well, and corticosteroids, but they were not presented today, so stay tuned for that. But I think overall it's a very reassuring study, even though there are some bias, but I think they really tried hard to minimize the bias. So reassuring data. I'm going to leave you with this. I think it's a good news. And I invite you to follow me on Twitter, Aurelie Najm, or to go on rheumna.com for more content.